we'll take time away from the cornfield and away from the feed a little bit. And we'll talk more back about the dairy operation. Whether we talk about a smallholder farmer or a farm that's milking 40,000 cows 3 times a day, it's still a complex, interwoven system that we need to deal with and we need to work with in producing our milk. And so when we talk to our students, we talk to them about the dairy farm as being a food manufacturing facility. Every day you produce raw milk, dairy beef, liquid and solid nutrients for the soil. And that the children, no matter what country you're in, that's your customer. And if you cannot produce a safe, wholesome glass of milk for the children of your country, then you need to be in a different business. And so then that means that the dairy farm has to be managed on a daily basis for animal health and well-being, public health, ecosystem health, food safety, food defense, food security, and still make money. I sound like a banker now, right? When it comes to animal health issues on a dairy farm, the 4 main animal health issues are mastitis problems, reproduction problems, nutritional anomalies, and foot problems. And so when we talk about mastitis then, we talk about it as a complex disease. It involves the cow, the people, the bacteria, and the environment. And we always talk about how prevention is preferable to treatment, to antibiotic therapy, and that's been a theme throughout our discussions today about antimicrobial resistance. Well, one of the first things I learned as a young soldier back in Vietnam was that you have to know your enemy. The same thing with mastitis. You have to know your enemy. You have to know when it's going to attack. And so right after calving, that first 30 days after calving is a high risk time for the cow to get mastitis. She's transitioning over new herd mates, new rations, new surroundings, and she just went through the stress of calving. Then as the lactation wears on, the risk of mastitis goes down and down in a well-managed farm. But then at dry-off, that first 7 to 10 days after dry-off is actually the highest risk of incidence of mastitis in the dairy herd. And then again, just about 1 to 2 weeks prior to calving, that risk starts to elevate again. And so if you know these 3 main time periods, then you can work with a management scheme and training situation to deal with. There are some other confounding factors. When we talk about coliform mastitis, then it's not a contagious pathogen in general. It's an environmental one. It's picked up from the environment. The other thing is that the animal can go from looking great to dead in a matter of hours, and that's very difficult to deal with. We also have to look at the idea that the bedding where she lives is very important. I'll explain more about that in a little bit, but the higher the bacteria load in that bedding, the higher the risk for her to get, in this case, a coliform mastitis. When we look at more about the enemy that we have to deal with, then we're going to look at the different types. The main coliform mastitis types are E. coli, Salmonellas, Campylobacter, Citrobacter, Klebsiella, Pseudomonas, Serratia. These are the main ones that you're going to have to deal with in working with the cows. The other factor is that approximately 50% of all dairy cows in the world have at least one bout of mastitis per lactation, per 305 days, and that's a minimum. In the case of coliform mastitis, depending on the environment in which she lives, this rate can go from as low as 1 or 2% to as high as 40 or 50%. And so you have to really pay attention, do your diagnostics to find out just how prevalent this enemy is. The other thing that we want to talk about then is that these pathogens can vary. In other words, you can have 15 or so different serotypes of coliform mastitis organisms on your farm at any one time during the year. And those 15 can change from year to year, depending on management factors, environment, and things like that. And so it's very difficult to predict who you're going to deal with. But the whole key has to do with managing the teat end, keeping it clean. So milking a clean, dry, pre-sanitized udder is everything. So feeding management, for instance, after the cow's milked, you want her to go back and to her feed and stand up at least 15 to 20 minutes to give this sphincter time to contract so that she can stop the penetration of the bacteria up into the street canal. However, if you don't, and the bacteria are there, then they make their way up into the street canal, and now the fight's on between the organism and the cow. And it can be a vicious fight. It can be a fight to the death, particularly when we talk about coliform. The other thing about this battle is the longer that it goes on, the lower the quality of the milk, the higher the somatic cell count, and the lower the production that you get. And so it's to your benefit to stop this fight just as rapidly as you can, based on management and based on knowing which organism you're going to deal with. What happens is that the neutrophils come in and they phagocytize the bacteria, they engulf it, and then they dump in their antimicrobial packs into this phagolysosome. And then these antimicrobial peptides kill the organism, destroy it as best they can. And then because the neutrophil leaves the bloodstream and goes into the milk, it doesn't live very long either, a couple of hours, and then it dies on its own. So it can die on its own and dump its packets in there, or it can die full of bacteria that are ingested and destroyed, and then that dumps the endotoxin into the milk, into the mammary gland. The result of that is inflammation. And what you get then is more neutrophils coming in out of the capillaries into the alveolus, blood, serum, complement components, all coming in and dumping into this alveolus. And so now you've got this inflammatory process started. And it's okay sometimes to call maybe one officer of the law to your house and talk to them about it. But when it gets to 200, 300, 4,000 at your house, now you've got a problem. And so the same thing happens here. The longer this inflammation goes on, the more things that can go wrong. The more it's amplified and the more prolonged it is, the more trouble you have for the cow. These endotoxins can have a lot of influence then on the lymphocytes, the neutrophils, the smooth muscle cells of different organ systems. We'll talk more about that. The platelets or the coagulation factors and the endothelial cells that go on. So what we have then is this endotoxin molecule from the cell wall of the bacteria then coming in and creating a huge set of problems for the animal. So I know it's very fashionable to talk about endotoxic shock, but the reality is we're talking about mediator shock. Look at all the different mediators that are released when endotoxin reaches these cells, like neutrophils, lymphocytes, macrophages, endothelial cells. You have all kinds of prostaglandins, and we'll talk about that. Interleukins, which even amplify the system, bring things more in. Bradykinin, which can slow the heart down. Histamines, which can help develop a different type of hypersensitivity. You have the catecholamines, which makes the cow can be dull. Disseminated intravascular coagulation, which means she has blood clotting problems and bleeding. Tumor necrosis factor, which a little bit is good, a lot then causes even more problems. And so, again, when you think about endotoxins, think about mediator shock, because you're not just bringing one compound into the mix, you're bringing hundreds and hundreds of different things that can happen. So when you get this situation where the teat end is breached and the organism gets into the mammary gland, now the cells, the macrophages that are here, set off the alarm, and now more neutrophils come in, more leakage occurs, and up in the top left corner, that's a coliform mastitis cow 1 hour after she'd been given the E. coli. Just 60 CFUs, only 60 colony forming units, and that's what she looked like in an hour. 4 hours later, this is what she looked like. On the pathology floor, this is the normal mammary gland. This is the coliform mastitis gland. So look at the swelling, look at the inflammation. These mucosal surfaces secure a lot of damage. And so you can imagine different organ system, an inflamed lung that looks like that. There are a lot of gram-negative organisms, gram-negative respiratory disease. In the rumen, can you imagine what all the rumen mucosa, if it looked like that, how well that cow's going to feel? And we've all seen it. She doesn't feel well. But that's what she looks like, because there are either volatile organic compounds in there, or there are endotoxins in there that then cause this damage, set off this mediator shock, set off this alarm system that takes place. And so when I was in practice, I would get a call and say, hey doc, my cow's got a coliform mastitis. And probably back in those days, even though I wasn't a great veterinarian, I mean, you could save maybe 20%. And a lot of them would die in just a matter of hours. Now, through management and through a vaccine, we can do a little better. But nevertheless, it's still a critical issue, and we'll talk more about it. But when you look at the clinical consequences of endotoxins in the dairy cow, of course, you're going to get fever. Then if the endotoxin reaches circulation, the first thing you get is a neutropenia, or a lowering of the neutrophil count. And you get a lymphopenia, the lowering of the lymphocyte count. So now the cow is susceptible to infection in a matter of hours. In respiratory disease, in vaccines, gram-negative vaccines often have endotoxins in them. And you'll give these vaccines, and then 3 days later, now you have a break of respiratory disease, Pasteurella pneumonia, or Haemophilus pleural pneumonia in pigs. And they'll say, well, it's shipping fever. Well, yeah, but it was caused by the administration of the vaccine, lowering of this infection-fighting capability. It turned the infection loose. Now the animal's always behind the curve, trying to catch up. And so are you, trying to help them out. So you get respiratory effects in the lung. You can get reproductive problems. If coliform mastitis happens between the 7th and 14th day of corpus luteum development, you'll short cycle the cow. It'll lyse that corpus every time. The reason? In that inflamed mammary gland, it produces huge amounts of PGF2 alpha. That gets in circulation, hits the CL, short cycles the cow. In mid-trimester, it puts the progesterone level below 1, puts the animal at risk so that she can be tipped over for additional abortions, or if she's within 2 weeks of calving, those cows will calve out virtually 90% of the time early, based on the coliform mastitis. So now we've got reproduction and pregnancy in it. Reduced milk production, we talked a little bit about that. Reduced milk quality is very obvious. It increased the risk of antibiotic residues in the milk, because the first thing that everybody wants to do is go in and treat with some form of something. And it actually doesn't do much good. Remember, it's a mediator shot. So anti-inflammatory approach. Digestive upsets, the cows go off feed, then that can cause more issues. It can result in sickness. Medical treatments are often too late, and prevention through good hygiene of the farm and the vaccine that's available are key components to helping everything out. So a lot of the thing about the coliform mastitis is management. Clean, dry bedding. The calving pen right after she calves is a crucial time when she can break with that. You've got to make sure that she has a nice, clean environment, which none of these pictures show. Here is a typical tie stall dairy that can be seen anywhere around the world. But look at what these cows have to lay on when they're done. It's wet, it's dirty, it's contaminated, and she gets up and down, and those cows are at high risk of a coliform mastitis. You've got to work with your team, you've got to train people and go in and explain the management side of this whole disease process, and keeping the idea that hygiene is paramount. Poor management can overcome good immunology anytime. Poor management can overcome about anything anytime. And so you're going to manage your way out. You're going to use tools like vaccines, like medications, like feed additives to help go after it, but you've got to train your team to avoid this at all costs. Figure out a way to do it, and then the tools that you apply that are coming along can help out a lot more. Again, when the teat in is where the mastitis battle is won or lost. If you can keep that clean and dry and pre-sanitized, you'll win the majority of the times. But once it's in there, then the inflammation sets off, the toxins are released, you get the swelling, you get the inflammation, and you get the cow at high risk. And again, organ systems like the mammary gland, the lungs, the rumen, the reproductive system, or extremities like cuts, lameness, all can create these inflammatory processes that are amplified then, and you get your mediator shock and you get your problem with your animals. So in the context of this, then we want to talk about the idea of One Health. We want to talk about the environment or ecosystem, the animals or livestock, and the people that you deal with. And where those converge right there in the middle, that's where we all live every day. And so we need to think about how we manage disease, animal health and well-being, public health, ecosystem health, and how we do that in a collaborative fashion by talking to one another. We had a great talk about nutritionists and geneticists talking to one another and how well that's going and what new kinds of things we're finding out. The same thing can happen if you're a poultry person and a dairy person. You can talk about common ground and problem solve together, and training. And training on farm is crucial. It's absolutely essential that we do more of that on a daily basis and that we talk with one another. So we team build, we listen to one another, we problem solve together, and then we put the process in place to go after these different disease issues. And so the world, the consumers are watching all of us, no matter where we're at. I don't care if you're in Rwanda or if you're in Rowan Park, New Jersey. There's a mom watching because she expects us and demands that we produce a safe, wholesome product for her child. And that's what we should do every day. Thank you.